Hi, my name is Corinne Gaffner, and I'm a registered nurse, bachelor's prepared, and have a master's degree in business. I've been a nurse for 30 years, and 25 of that has been in home health. And so I've seen this industry grow and change tremendous amount over the last 25 years. Recently, with all the healthcare changes and things that have been coming about, hospitals have been trying to think of ways that they can become more efficient in terms of getting patients the care that they need and out of the hospital sooner. And so home health has been a tremendous help in doing that. Let's face it, patients in the hospitals don't rest, they don't sleep, they have no control over their environment because they're under the control of the doctors and the nurses and the staff that's there 24/7. So a patient has the opportunity to be discharged from a hospital after, say, an exacerbation of a disease or a new onset of the disease process. They can come out of the hospital and recoup at home a lot better. You know, in the home environment, they can have, obviously they can sleep better because they're in their own bed. It's not as noisy and it's more comfortable, and they have more control over their actual care and recuperation. Home health allows the patient to participate in their care. So what we do is go in and establish a plan of care with the patient, and the nurse will go in and talk with the patient, or it could be a therapist, and they'll go in, talk to a patient, find out what it is their needs are. We can discuss with them and educate them in regards to their disease process, the new medications. Nurses will work with them, heal or changing dressings if necessary, even educating family members. Some patients have long-term treatments that need to be done, and the nurse may have to teach a family member how to do it. Home health is not a permanent thing. It's usually a temporary situation until the patient is more independent and able to take over the care for themselves. We have nursing, we have physical therapy, we have occupational therapy, home health services, home health aid services, as well as a social worker. Depending on your insurance, pretty much all the insurances will cover all of those, with exception to maybe the home health aid and the social worker. But they all have different roles. And like I said, the nurse is more in tune with doing the hands-on wound care or education with medications, monitoring to make sure those medications are working correctly, and reporting back to the physician. Physical therapy deal more with the overall strength and endurance. Patients that come out of the hospital are weak, and it doesn't take long to lose your strength when you have an illness and you've been in bed for a while. And so physical therapy can work on building that strength and that endurance, and helping them to become more independent with the home exercise program. And they'll work with the patient, they'll establish, find out what their goals are, and develop an exercise program where they can work with them and monitor them, show them the correct way to do those exercises, and leave them some homework to do maybe on the days that they're not there. Occupational therapy is the same way. They also work with building endurance and strength, but their focus is a little bit more with upper body. And say, for instance, a stroke patient may need help in terms of learning how to put stockings on, or even cooking. Some people that are in wheelchairs, and they're new into a wheelchair, they haven't done that. Their home needs to be adapted, and there's safety issues that need to be looked at. They can't reach the food from cabinets, and that's what occupational therapists do. They'll also assess the home safety in the shower and the patient's ability to get in and out of the shower. And, again, it all has to do sometimes with just weakness. If patients come out of the hospital and they're just too weak to be able to get in and out of the shower on their own. And so a lot of times the home health aide will work hand in hand with the occupational therapist just until that patient has more independence and is safe in terms of showering on their own. Okay, social worker, they're in there maybe to help a patient see what community resources are available to them. And then speech therapy, also we offer that. Again, they deal with patients who have maybe swallowing issues or speech issues. And not just that, a lot of people don't realize that they also deal with patients with cognitive issues. It could be stroke, it could be dementia. They can work with patients to improve their memory. One of the things that makes us different from other home health agencies, all basic home health agencies will offer that service, especially if they're Medicare certified, which we are. But what makes us different from the other agencies is the fact that we are associated with a outpatient outpatient physical therapy clinic. And we have therapists that work both in the home and they transition in the clinic and in the home. So we have that continuity of care. And so when a patient comes out of the hospital, they may be in the home for maybe a week or two, maybe a month. And once they get their endurance back up, their strength built back up, then the therapists will contact the therapists in here and say, hey, I think they're ready to transition into outpatient. They'll send them in. And sometimes we have the same therapist working with the patient in the home as they do, in the outpatient clinic, because they all will, the majority of them, I should say, can go out into the home and see a patient there as well, which is really nice because no other agency offers that continuity of care, and it increases their chances of getting well quicker or more quick. I'm not sure what the English, proper English on that was, but they can become more independent a lot quicker, I guess is what I'm trying to say. We have therapists and nurses that specialize in different things. We can deal with pediatric patients, and we have some physical therapists that also work with pediatrics, which is also a specialty. Not very many other agencies provide that. We specialize in dealing with pulmonary patients, and we have a pulmonary maintenance program that we offer in the outpatient clinic. And so, for instance, a patient who's coming out of the hospital, and this is respiratory season coming up, may have pneumonia or an exacerbation of their COPD or asthma, and they're in the hospital for being treated with antibiotics. They might be able to transition them home, and nursing can come in and educate them on their medications and monitor, make sure the antibiotics are working correctly. We can have physical therapy come in and begin working with them to build up their endurance and strength. And once they're at that stage where they're more independent and they're able to drive and they're able to come into the outpatient, because the level of therapy is different in the clinic. They have the bicycles. It's a little bit more stronger, I guess I want to say. It's harder, a little harder level. So they work in the home to build them up to this point, and then they can bring them in. And we have the pulmonary program here. And so depending on the insurance, we may be able to put them on a maintenance program because the pulmonary patients need ongoing exercise. And so that's nice. That's unique with us as well. We also do lymphedema. They do that here in the clinic as well, but we can do it in the home. And it's the same thing. If they're homebound, we can have one of the therapists that are trained in lymphedema go into the home and actually do the leg wraps and things that are there. If you're interested in home care or if you have any questions, please give us a call. The referral process, in terms, if you're coming out of a hospital setting, the case managers will usually give you a list of home health agencies to choose, and you have that right to choose. So even if your doctor says they would recommend this one, you still have the right to choose whatever agency you see fit. So I'm encouraging you to do some research, to call us, come by and visit us. We will gladly give you a tour of the facility. You can meet the therapist before you even go in for a surgery. Same thing with the home health staff. And we will gladly sit down with you, talk to you, or even talk to you on the phone in regards to whether your insurance is covered and what kind of services you might be needing, or any specific specialties that you might think that you need. And just all I can say is give us a try. We have some awesome therapists, and we have a lot of unique features in regards to our home health agency. So please call us, and I'll gladly talk to you.